Did you know testicular cancer is one of the most curable cancer? Hello friends, I am Dr. Sachin Gupta. I am Director Medical Oncology and Hemato-Oncology Department at Max Super Specialty Hospital in Mohali. In years of my practice, many patients have asked questions about testicular cancer. Today I will try to answer some of the common questions about testicular cancer. So what is testicular cancer? Basically, every man has two testicles. So these are the organs in lower half of the body where sperms are produced. And any cancer developing in testes is known as testicular cancer. There can be many types of cancers developing in testes, but the germ cell tumors are the most common ones, and these are the most curable ones also. Uncommonly, there can be carcinomas or lymphomas developing in testes, but the germ cell tumor is the most common. The second most common question asked is, what are the symptoms of testicular cancer? Now, most of the patients would present with swelling in the testes. So that is the size of one of the testes can increase. And to begin with, it is most of the times painless. So we have to believe that most of the cancers, when they start, are painless to begin with, and later on they can become painful. The other symptoms can be some dragging sensation in the groins, and once the disease spreads to other organs, the symptoms can come depending upon the organ to which it has spread. Like in abdomen, it can create some pain or constipation. If the disease spreads to the lungs, it can cause some cough or breathlessness, and likewise depending upon the organ. So we have to catch the disease early. The swelling is not to be missed, which is the first symptom. The obvious next question is how to diagnose testicular cancer. Now it's very easy, and any expert cancer specialist and surgeon can do this. First thing is to examine the patient. So we look for testicular swelling, and then we proceed for some blood workup and scans. In the blood workup, we have some tumor marker tests like alpha fetoprotein and beta HCG and LDH. If the markers are high, they can suggest that it's a testicular cancer. And then we go for an ultrasound examination of the scrotum, followed by CT scans, MRIs, and nowadays we have PET scan also available, where we can scan the whole body to stage the disease and to find out to what extent the cancer has spread to other organs. Once this is done, we are ready for the treatment. Now I will come to the most important question, that how is testicular cancer treated? So the treatment always depends upon the stage. Most of the patients come to us with swelling of the testes, so we have to operate the patient first. So high inguinal orchidectomy surgery is done, in which the swollen testis as well as cord is taken out, and we send the specimen to the pathology lab. So in the lab, we try to find out the stage to what extent the disease has gone. And once this is done, we decide further that whatever chemotherapy or radiation therapy is to be done to prevent the recurrence of the disease. But if the disease has already spread to other organs or in the lymph nodes, then these patients definitely do land up further chemotherapy. So typically 3 to 4 sessions of chemotherapy are done, which last for about 3 to 4 months. And majority of these patients can be cured by doing chemotherapy. And some of the patients don't even require chemotherapy, they can be just early stage patients. And once the treatment is done, these patients are followed up with 2 monthly and 3 monthly tests, which can be blood tests, tumor markers, and some simple scans and x-rays and ultrasounds. And we try to look for if any recurrence has happened. Majority of patients can be treated and cured by this treatment. An obvious question which comes to the mind is the quality of life of these testicular cancer patients after treatment. Now these patients are young patients, as testicular cancer happens most commonly in young men. So after this surgery and after having chemotherapy done, most of the patients go back to normal life, and if they were not married by the treatment, they get married, they can have children, and there are very few issues in life, and majority of our patients do well in their careers and do well in their married life as well. There are very few side effects which are commonly manageable, and the follow-up is also very simple with few blood tests, few scans, and the patients are absolutely fine majority of time. Today I have answered some of the questions about testicular cancer. To summarize and to highlight, testicular cancer is disease of young men. It presents with a swelling and enlargement of the size of the testes, but we have to remember this is the most curable one. And the treatment is simple, a simple surgery and some chemotherapy most of the times would save the lives of these patients. So please don't ignore your symptoms. Any swelling or lump in the testes, please show to your doctor. Don't hesitate. I hope you liked this video and found it informative. If you have any doubts or queries, please do write to us and send your comments below. Thank you.